Namaskara and hello to all our viewers. When I was a child, I had never heard about this varicose veins. But today, every alternate person seems to be dealing with some kind of leg pain or tiredness in the legs. Why? What is happening? To understand this, we have a renowned vascular surgeon with us, Dr. Rajah Koppala. Welcome to the show, sir.
Namaskaram.
Sir, first I would like to understand how a doctor who was working in the US came back to India. I mean, that is a very surprising story to me. Could you please tell us something about it?
Sure. I mean, you were saying that you were also been in US, and it is a big move. To be fair, American quality of life can be very, very exciting, very nice. But a couple of thoughts came in my mind. I went to US. So when I was preparing for my US exams and stuff, it was like, I would do anything to go to US. That kind of ambition I had. Yeah. And I went there, and by God's grace, my education went off very seamlessly. I got a very good job. So the highest job you get as a doctor in US is called partnership. That means you're a co-owner of a big business. So I became a partner by 2004. But then, see, something happens after that. Then you start accumulating these dollars, and it seems like just another figure in the bank. But equally importantly, you start to ask yourself, at that point as a partner, if you are getting $1 million pay, you'll pay something like $400,000 in tax.
Right.
I'm thinking, all my hard work and my tax money is going to another country. You need your own. Had I done the same work, had I paid the same tax, it would have benefited to some more of my own countrymen. This is point number one. It was a very big guiding force that, I need to give back to my country in some form or fashion, if nothing else. Even a most commercial private practice doctor who pays taxes is doing more for India than a guy living in America, right? I mean, it's very clear, very straightforward. So that is one. Two is, I wanted to stretch my luck further. I've been very lucky, by 38 I'm a partner, life was so comfortable, cozy. I wanted to see if I went there with 2 suitcases and can go that far, I can come back with far more to India, and what more I can do from that point. So that has been my driving force. Always want to do something back for my country. Some selfishness that best mind should work for our country than be elsewhere. I had that selfishness about me. And most importantly, to be fair, 10 years hence, now that I'm living my life, actually doctors do very well in India also. It's not like there's a huge delta between quality of life here versus there. Good, successful doctors in India are very, very comfortably placed. So that is, of course, some validation I got later on. At that time, I didn't know that. But these were the driving forces. Want to do something back, do something impactful, do something big back in my country. And that was something driving me.
Excellent. If there is any other example to be a patriotic person, I don't think there would be many. Wonderful to know that, doctor. I also wonder why you chose this particular area, the vascular area, because branches, if I should say, would be cardiology and orthopedics and so on. Why did you choose vascular?
So I'm actually a vascular interventional radiologist. So basically I'm trained to use radiology images to treat people. So this is a very, very subspecialized field. And at that time when I was training, only US had it. Such training was not available anywhere in India. Very few centers were there at that point in time. So obviously, since we are early movers, there had been tremendous growth in that area. It is probably the fastest growing field even today. It's growing at 30% year on year. So there's tremendous amount of patients to treat, volumes, and the big trend in the world is, the life-threatening problems are all being solved. If you have a 3-vessel block, you'll do a bypass. You'll make him live 10 years longer. You have cancer, you have immunotherapy, you can make him live 5 years longer. Right. So when you live longer, you'll have lifestyle problems.
Correct.
Life threatening is over because there's not much to treat there. Lifestyle will start, and lifestyle are your knees are being replaced, your legs will ache because of vascular problems, you get a foot ulcer. So these lifestyle problems, the doctors who treat them are now much more in demand because that field is saturated now. There's a lot of doctors delivering that care. Whereas lifestyle diseases, which is all like knee replacements, this, that, hip replacements, varicose veins, vascular surgery, they're all now very, very, very much in demand. Of course, I didn't know then that will be so much of demand, but it was just serendipity and some destiny that led me there. But there's a huge gap even in US. Even US also, very few people actually take up this career, whereas patients are there. For your information, 1/3 of Indians will have varicose veins.
1/3?
Yes, at some point in their life. So there's enough people. Right? It's just that there are not doctors to treat that, and the doctors out there are not so well versed with the modern technology that can help you treat this well.
So, doctor, are you saying this varicose veins are also related to lifestyle?
As in, what I meant at that point when I was telling you was that life-threatening means there's a risk to your life.
Correct.
So how we used to think is my grandmother, my mother, all say, is this life emergency? Okay, we'll treat it. If not, we'll leave it.
Correct.
That was a mindset till 10 years ago, right? You put a stent, why? Otherwise you will die. Or you need a stroke, or you'll get another stroke, you'll be paralyzed. Or cancer, you will die. So this is kind of scare that we used to make people act on them.
Okay.
But as people have more money now, more spending power now, they're living longer now, that problem is solved. You have a triple vessel disease, you put a bypass, you're fine for 20 years longer.
Right.
Then you're living longer, your knee will pain. Right? There's nothing wrong with your lifestyle, but you need to live a good lifestyle is what I meant. You need a good life, quality of life. And if you have these ailments like varicose veins, venous ulcers, leg pains, knee problems, you will not live a good quality. You'll be living longer, but you'll be bedridden, sitting on a chair, not walking anywhere. So people want to do more with their lives. People want to, get on with their lives. There are very few children who will sit back and take care of the parents. Right? Everybody has their own life now. So these have become like in America lifestyle, this is a big thing. So that's something I got the chance to get into that field early.
Okay. Thank you, doctor. Let me try to understand what exactly is varicose veins. How is it caused? How does it get aggravated? What are the usual symptoms? And what should people do, basically, not to get it?
Right. So what causes varicose veins? So we have vessels that take the blood to the leg and vessels that bring the blood back from the leg. Right. The vessels that come back from the leg are called veins.
Right.
Now, for some reason, the valves within the veins are not working well. Blood doesn't come back, but instead goes back into the leg.
Oh.
So the blood starts pooling in the legs. That is the meaning of varicose veins. So blood is pooling in the legs, it's not moving out of the legs, and it's collecting there. So in some people you see it like big veins that are visible outside. In some people you will see it like the leg is becoming black, it's painful, it's getting ulcers. Small injury also doesn't heal for a long time. People feel like somebody should press their legs after they go home. All these are vascular symptoms, right? Varicose symptoms. So these are the symptoms, and the reasoning is that for some people the valves that are in the veins don't work very well, so they keep slipping, blood keeps slipping.
Okay.
So that's the other thing that you need to be aware of, and it's very common. Like I said, there's no specific reason why it happens. It's very common, but we do think that people who stand more are at a higher risk of getting the problem compared to people who are walking and doing more exercise and continuously on the move. People who stand and be static or even sit and be like that for hours together, they're at a higher risk of getting this problem.
So, doctor, there is a saying, the sooner the better. Correct. Does it apply to varicose veins as well?
It applies to all healthcare issues, sir. Obviously, there's no doubt about it. But yes, it applies significantly to varicose veins for two reasons. One is, by nature, Indians generally approach any problem much later, healthcare problem. It's just a thing that we have it in us. Of course, some of it is driven by the fact that, there's some cost involved with going to doctors and all. Accessibility is an issue. Only big cities will have good quality doctors. So there's some delay on the patient side anyway.
Okay.
So a patient, let us say, approaches a vascular doctor at step 1 in America, they'll approach us in step 4 here. They go the other 3 steps only, then they come anyway.
Okay.
Then from that point onwards, it is only a one-way street. It keeps on getting worse. So you need to tackle this problem early. To give you some perspective, if you treat the problem early, literally with the modern technology, you require no follow-up. You don't have to meet the doctor also. It's a 10-minute procedure and you go home.
Wow.
Versus you come at stage 6, which is an ulcer in the leg, which the leg becomes black. You'll have to follow up every weekend with me for at least 7 to 10 weeks.
My God.
Just the cost of traveling in and out of the hospital can be run into thousands for many people.
Oh.
So it's so important from cost angle, from patient benefit angle, to approach the problem early. And remember, in India, if any patient says to me, I'm in early stage, I know by default he's not, because nobody comes in early stage. I'm telling you, not even 2% of patients that come in early stages.
That's actually a very serious point. Actually, most of them are coming to you at not at all at the stage 1 or stage. They're coming at stage 4.
Stage 5, stage 6 actually, to be fair.
Oh my God. Okay.
Yeah, so it's very sad. So that's something to remember. Anybody, anything, even if you have BP, people with 150, 100 keep saying, no, slightly, boss, 150, 100 is not slightly. It is a problem at which you start getting heart issues at 150, 100 uncontrolled. I mean, that for me is a poor control.
Right.
Somebody comes with a HbA1c of 7.5 and say, no, sugar is mostly, not mostly, sir. 7.5 is abnormal. It's highly abnormal. I should control it. At that level, you will get neuropathy and retinopathy. So these are some things that we notice all the time in India.
Okay. So what would be the complications if somebody doesn't come to you at the early stages? What can happen as a progression to worsening this varicose veins condition?
Right. So in early stages, you have some visible veins, leg pains. So that stage 1 is small visible veins. Stage 2 is slightly larger veins, but they're still visible. Stage 3 onwards, you start having symptoms. Leg will swell up, leg will have other issues, leg will have slight color changes. And by the time you reach stage 4, you have severe color change. So almost the area below the knee becomes really black and abnormal. Stage 5, you start getting small ulcers. That means the skin starts breaking down, and by stage 6 you'll have big ulcers. In fact, a lot of stage patients go into gangrene. So this sort of thing is not fair. I mean, you cannot wait till stage 6, and from that point, bring you back to stage 2 or 1 is very, very difficult, even in good hands like mine.
Okay.
Because so much of water has passed under the bridge.
Yeah.
But it is still, imperative to treat it.
Okay. I have heard there are other methods of treating varicose veins, especially the one which I have always heard about is this leech treatment. Is that effective? Does it work?
I would not trash it too much. There is some science there. So blood is pooling in the legs, right? So leech is sucking your blood.
Okay.
So it is releasing the pressure in some way.
Okay.
Until there, the principle is okay, no doubt. But the point is, how is the leech's mouth? Does it have any bacteria in that? Is the leech clean? Is the location clean? Suppose I want to put a needle and take blood from your leg, I'll do it with spirit, I'll clean it and all. But leech will not do all that.
Correct.
So it is not, there is some physics. So maybe 100 years ago, before all the technology came, if you got leech treatment, no problem.
Right.
Very good. But now there's no basis to get it, because why? You have so many better methods to do this. So there is 1%, maybe 5-10% science in that, but other 90% is all other things around that, right? The leech is dirty, the water is dirty, where the leech is growing we don't know, what is in the mouth we don't know. So all the damage will happen because of the other things.
So in your career, have you come across people who have taken the scientific approach first and then gone back to the home remedies, and then realizing that it is bad, they would come back to you? Has that happened?
Very common. It's very common. Like today I saw 70 patients. At least 6 of them would have seen me 2 years ago, went back, they didn't believe us, they wanted to do some home therapies, and then came back with much more damage. So it's very common. It's very sad, but it's very common. Some of the common home therapies are putting hot salt on the leg, putting some chemicals, homebound, something home oils, geels. Unfortunately, there's one very spurious website that advertises in the same place where I advertise in every Facebook ad. Just below me, you'll put
oh my God.
About some oil. You put some oil, the veins will go away. Okay. All that is complete nonsense. If anything, it makes your leg worse. right? It is a flow problem, it's a physics problem. Blood is not flowing. So how will some chemical around that work? It will not work. It all causes damage, it worsens damage. Some parts of India are more, they trust these alternate treatments more than other parts of India.
Oh.
You know, I've seen this more in southern Karnataka, for example, eastern Andhra Pradesh, Tamil Nadu, Kerala border, a lot of border towns. So there's somehow more belief, and unfortunately, it's really unfortunate because, government should be telling them not to do it, there should be regulation around it, but unfortunately, they really delay the treatment, trusting this, and that can be.
Let me come to how Avis Vascular Center is different from the other medical establishments that are treating this particular, should I call it a disease?
Yes, it is a disease.
Yeah. So how the other medical facilities are treating it and how Avis makes a difference.
The first thing is at the approach level.
Okay.
What are you approaching the problem with? So if I am a guy who is a procedurist, I want to put laser, I want to do this. For a guy like that, for a guy with a hammer, everything looks like a nail.
Correct.
Right? So he wants to do laser, left laser, right laser. We approach the problem as what's the problem? And is laser best? There's a newer technique called glue, that is best. Or doing nothing is best. Or if you have visible veins, we do a procedure called flax where you burn the vein from outside. So all that we evaluate. So we are a vein care, 360-degree vein care hospital. Versus most establishments do one procedure because that earns them money and they will do it and go home. So many competitor ads you see, we do laser for less, more. Actually, no patient wants to worry about less or more. Patient wants to know, can you cure me or not? Right? In that cure, this is one part of the algorithm, whether to do laser or not. I can cure it by not doing laser, I can do it by some other. So all that intelligence you should use on assessing the patient. Right. And that's where we are very good. So you asked what separates us. I mean, there are so many occasions where somebody has read about me, they traveled all the way from Mysore to get a surgery in Hyderabad. And I said, no, you don't require. He's been upset also. But I said, you don't require. Okay. I can do laser, I'll make money. But I said, boss, you don't require. Because my word, for me at this level, at our level, we're done 35,000 cases. Oh. At our level, one case going bad or one case doing unnecessary is much more of a damaging thing than others. So that's the kind of reputational damage that we think about. So if you see a lot of internet-based providers are there who will do for 20,000, 30,000, will pick you up, drop you. All that is not needed. You actually have to assess the patient.
Yeah, you spoke about the money part. I'm really surprised, I'm really aghast actually, how one treatment can be done at some 35,000, 50,000 rupees and some other hospitals can go on charging till in lakhs. How is that possible?
So there is two levels of problem here. One is if you are a large hospital, let us say you have big real estate in middle of Bangalore, Old Madras Road or somewhere, you have sprawling 2-acre hospital. So a lot of the pricing is to recover the money involved with establishing such a big setup.
Okay.
So the cost of goods is so much, cost of doctor is so much, but there is a facility fee that you are paying. That's the extra that you're paying. That is one part of the story. Then the other extreme is this, surgery aggregators and all this 30,000, 40,000, 50,000. Problem with that is there is a point below which you cannot do it properly. Right? I mean, coconut will be 100 rupees in the bandi. Then coconut wholesale will be 60 rupees. If I say I want coconut for 5 rupees, he'll say go and climb the tree and take it. Correct. Then I'll fall from the tree and break my back. So the same way, beyond a point, this price cutting doesn't work. So for example, I use only a product called Metronics. In Metronics, the laser cost, the RF cost is 57,000 rupees. Oh. So if you put 10,000 for doctor, 10,000 for hospital, nobody in his common sense can do a single leg operation for less than 70,000 if you use the right equipment. But what do people do? They'll use that equipment on you, wash that thing and use it for me.
Oh my God.
Then what happens? What happens is that thing will not work. First of all, it's not correct. Second of all, it is not that doesn't work the same way. The second time, third time, it's not made for multiple uses. So to give you a perspective, so sometime we'll take a closer, but there's a price written here. It's 57,000. So if somebody is saying I'm using this for 30,000 rupees, how is it possible? Not possible. So that sometimes some patients don't have I suppose the basic knowledge to ask them, are using high. So this is the best company. So if any patient wants to know for vascular venous procedure, are you using Medtronic or not? They have to ask this question. This is the world's best company. Now the Avis way, I will not cut the price to use some substandard product. Right? So I will stick to my price. So the pricing is derived from multiple issues. One is your hunger to get patient and use substandard equipment. Other is you have such a big hospital that you service the other requirements of the hospital. So this way the pricing is so different. We of course have one single price across all our 21 branches. We are that way very clean. We have one, but we can't cut it to the 30,000 rupee level also. Because it makes no sense, and I don't want to do a failed case knowing it will fail. For a patient, whether he pays 30 or 70, if the surgery fails, he'll be equally upset. Because again, he's do the same thing. No, it's a waste for him. So in medicine, patients should not always think about cost benefit. They should also think about effort benefit. Money, you are going to hospital every day. Is not getting better. Doctor is, you are very upset with doctor. Again, you have to go back, park the car. So every day you're going, this is also money, no? Leaving your work and going for 10 days. So people have to think like that. So they would ask the question, where is the success rate highest? Which doctor has done the highest number? Not the 5,000-10,000 rupee difference. That should be the last criteria. In their mind, because you have only one leg. You can't get a new leg. You can order KFC burger at a cheaper price and throw it if it's not good. If you don't like it, throw it. You can't throw your body. So it's very important to realize.
Absolutely. Wonderful point you made there, doctor. You spoke about knowledge among the patients. Now, I have seen on so many occasions, patients lose trust on the doctor just by the responses he or she gives them. And then they go back to their home remedies, and then they do something else and worsen the situation. I don't know what. So I want to know what should be the knowledge that is to be with the patient to ask the doctor about this particular disease.
Some other doctors will disagree with me that a lot of knowledge you should actually acquire from net. Nothing wrong with it. See, doctors complain that patients reading too much internet knowledge and all. But see, doctor also is reading internet, no? So yesterday, two doctors were discussing some Operation Sindoor or something. So what do we know about warfare? Why we are talking? So see, knowledge cannot be stopped. You will acquire knowledge one way or the other, right? Good or bad way. So I don't think that's very relevant. A lot of doctors don't like patients asking questions, but I encourage them. You ask her, because that way I feel is more knowledge. He knows me because I am doing the perfect thing, the right thing. He'll appreciate me better if he has more knowledge.
Absolutely.
So one thing I always tell is patients should be educated. Unfortunately, of late, due to commercialization and these apps that have come, not everybody is your well-wisher. Not all doctors are your well-wishers. They may go for their own commercial interests. So it's very important that patients should learn. I personally believe at least 99% of our Google reviews are true. At least the negative reviews are true, because 1 minute I spent less, that fellow gets very upset. He writes one, sir, didn't spend any time. So I think for me, it's a positive feedback. I'll go back, I should have spent more time, I go back, see the video of this patient. So I think patients should, there's a lot of internet sources. You should listen to shows like this. I think they should go with some understanding of the disease. Almost everyone nowadays who is educated should understand the very basics. If he does not understand, should insist the doctor spend enough time for them to explain. Okay, none of my consultations are less than 10 minutes. 3 doctors will see you in Avis. And will clearly explain to you. If anybody says I have not understood, I will explain again. Because then he becomes your advocate. He understood the problem, he wants to solve it. So that's very important to read.
So just to make a few points, as to what should be the right questions that the patient should ask you when they come to you with varicose veins.
So I think the important questions are, sir, can you explain the problem in layman terms that I can understand? Okay. 2, So what are my treatment options? Okay, what can I do? Which is a costly one, which is a cheap one, whatever. 3, then by doing this, what is the success rate? Will it succeed?
Okay.
4, if it fails, what recourse will I have? For example, my place, anybody who fails, we perform surgery free of cost. Repeat one, always, across 10 years. I clearly tell them, boss, it will not fail, 2% it tends to fail, but if it fails, I'll take care, don't worry. Very clear. But, so that's something you need to, but most important question I think is, I'll tell you, sir, in my locality, in the place where I know, can you give 5 phone numbers of the patients that you cured? Let me talk to them. And I will happily give you whichever part of Andhra or Karnataka you require. From any town, Jubilee included, I can give you 5 people's names where you can happily inquire about me and then get your procedure done. I'll give it in writing.
Doctor, I think now I know the secret of your success, because you have given so much proof about the way you treat patients, and that is the reason why you are successful, and that is the reason why Avis Vascular Center is...
Precisely, you only when you enfranchise your patient and make them stronger, then only he becomes your advocate. It doesn't work that you keep pushing at him. Everybody knows now. Nowadays, see, those days where doctors told Namaskara, go, there is no longer the case.
Correct.
Everybody has a brain now, and that's right. That's how it should be. And you know, when I go with my family to a doctor, I expect the same thing.
Correct.
So that's what we should give.
So I have also heard about the machinery, the kind of setup that you have at Avis Vascular Center. Can you tell me something about it? How is it different from other medical facilities? What magic have you done with that?
So the magic is actually self-perpetuating. I always say this, you know. So you have set up only a vascular unit, which means your success has to be much higher than others.
Correct.
Because see, how will I survive? Only if patients come. Why will patients leave Apollo and come to me? Because my success is higher than them.
Correct.
If success has to be higher, you need better equipment.
Right.
If you have better equipment, your success is higher. So he will bring more patients.
Right.
So like this, it keeps on building a cycle, a positive cycle, a good cycle.
Okay.
Right? So, number one, for example, I've never moved out of this brand. Medtronic is the world's best brand.
Okay.
Everything is 30% more expensive here. It's okay. If some surgery fails, I'll take the cost, but I buy only this.
Okay.
Now, this would be called as a vein viewer. So, those chica veins that you have.
What is it called?
It's called vein viewer.
Vein viewer.
Yeah. So, chica veins you have, it's sort of it's like an augmented reality projection.
Okay.
See the green thing?
Yeah.
It's the veins.
Yeah. Oh my
It can show
God.
veins on anyone, anywhere.
Okay.
So this guides me to put a mark on that and treat them.
Oh.
So I use this, put a mark with a pen and treat each one other.
Okay.
So all the skin veins,
Yeah.
those ugly veins, people who want to wear shorter clothes, mostly women, those little veins also we can treat.
Oh.
So that process is called CLACS, cryo laser and cryoablation, cryoscler.
Okay.
Now in India, nobody else has CLACS.
Wow.
So I had to get this from Brazil.
Okay.
This one I got for 14 lakhs from Brazil.
Okay.
Right? The other, so you name it, if there's a vein product anywhere in the world, it'll be there in Avis.
Fantastic.
Not because I am a very excited guy or I want to do philanthropy. I get so many patients also.
Right. Right.
So if you want to make a business case to use this in a hospital, a private hospital, who will buy this for you? So suppose I work for XYZ hospital and they say I want this 15 lakh rupee machine
Correct.
to put light. Will you buy it? He'll never buy. So that's a challenge, you see. Then he cannot see the veins.
Right.
So sort of, you need to understand, right? If you did this well, you get more patients, then you can do it better, then you get more equipment. So it keeps on building one step onto another. And that can be created only by having a large system like this. End to end, all aspects of vein. Those kutty veins that you see in the leg, to ulcers, wounds, everything we manage here. And that's where patients come.
Wonderful. Wonderful. Now that you are, I feel you are way ahead of quite a few vascular care centers. So what would be the future of Avis in the next, let's say, 10 years? What do you foresee?
So I think we have big plans.
Okay.
I personally think all things that are not medical emergencies or requiring multiple systems, you should not go to a corporate hospital.
Oh.
Like eye care, what is happening? You're going to eye hospital only now.
Right.
Infertility, go to infant hospital. Like that, vascular care will come out. I think in future ENT will come out because these are small things which you can be done a small way in a place that's very cozy and perfect like ours. Then go into a big hospital, go to left counter to pay your money, go to right counter to buy your coffee, go to XYZ counter to pay insurance, then wait with the insurance team for two days, then back follow them up, shout, scream. We don't do all that. All patients are told on day one, this is what it is. We know which insurance company, how much they'll pay for a person also, I know back of my hand. I don't need to even argue with them.
Okay.
I don't argue with you also. I tell them, boss, this is what they'll pay, you please pay up. So this sort of smoothness and ease of operations will become a norm for all small problems that can be easily solved.
Okay.
Number one. So keeping that in mind, we want to expand as a single specialty centers across India. So currently we have 21. In about next 2 years, we'll spread to 70. And then of course it grows. So we are venture capital funded. We have a private equity that's backing us now.
Okay.
And then, we want to go IPO in 5 years, hopefully.
I think Dr. Rajah Koppala has been doing a phenomenal job as a vascular expert, and he has plans of expanding his activities across India in the next few years. So thank you very much, doctor, for educating the patients as to what they should ask and why they should come to Avis Vascular Center. And I wish you all the very best in your ventures. Thank you so much.
Thanks.